Yeah, I mean, obesity in America, 2016, we got 650 million people in America that are obese. It's a ridiculous number today, like more than ever before. But to wrap up here with this, I'm going back to one of the things you and I talked about at the beginning with the influence of big pharma. The national expenditure for cancer care in 2018 was $151 billion. That's a big number. That's not a small number. That's a very, very big number. So then the question becomes the following. Is it a good thing for the folks in business for us to truly cure cancer? Or is cancer a very big business that creates a lot of jobs that maybe we do have the cure, but we don't want to cure? Or am I, going a little too deep into the, because you kind of know where I'm going with this. I'm just asking you a question. $151 billion a year industry, that's a lot of jobs right there. If we were to divide that between how many people at $100,000 your salary can we get at 150 billion? I'll do the math for you right now just to kind of figure this number out. If we got 150 billion, 100,000, that's 1.5 million jobs at $100,000. If we were to cure cancer, we lose $100,000 year jobs. Is it 150,000 or is it 1.5 million? It's a lot of jobs. 1.5 million $100,000 jobs. So are there people that really are kind of like, well, we kind of can do something to get rid of it, but should we really? I don't know. Let's kind of keep it around a little bit. What are your thoughts on that?
I think people are trying to get rid of it. First, they'll never get rid of it because it's actually a part of ourselves. That is, it's impossible to eradicate cancer risk completely because it's the part of the way that we do life, right? These cancers are actually, they're perversions of our own cells. So we can't actually get rid of it. It's impossible. And I think that, yeah, it's impossible to completely get rid of it. You can lower your risk in many different ways, but you can't ever get rid of it completely. Now, I think that there's so much cancer that nobody's thinking that we shouldn't try to get rid of it. But what they've done instead, which is rather despicable, I think, but what they've done instead is that they've raised the prices of these drugs so incredibly high that a single course will be like, these new drugs. So I'll tell you, the old drugs would have cost you if you had to buy it and didn't have insurance, a couple $1,000 perhaps, right? So when Gleevec, which is one of the big breakthroughs of the genetic era, it was probably like $2,000, $3,000 for a year for one patient. Now you're talking about $200,000, $300,000. That's the price of a course of these medications.
Wait. Let me stop you there. So you said it used to be $2,000 per year per patient. Now it's $200,000 per year.
Now, these are different drugs, but to give you a sense, so in 2000, that was sort of the best cancer drug you had, and maybe about 2,000, 3,000. That was a lot back then. So normal, blood pressure drugs would be like $80, right? So 200, 300, 400 is expensive. 2,000 was like, wow, that's really expensive, but the drug was great. So if you were to get a sort of state-of-the-art drug, not that drug, but a different state-of-the-art drug today, most of the price tags are $100,000, $200,000. It's insane. It's insane. So what they've done, of course, is instead of saying, okay, let's get rid of cancer, they're like, well, each cancer case, instead of bringing in $2,000, we'll bring in $200,000, right? 100 times the cost. Now, as I'm saying, that those are two different drugs. One is like a biologic and stuff, and it's newer. But at the same time, that is sort of state-of-the-art drug at that time. So it's really a huge hot button issue because people are saying, even if you can develop these drugs, nobody can afford them. So in the end, it's the same. You're not doing anybody any good because you're pricing them so high. And the problem is that the price of the drug has nothing to do with how much it costs to make. So, for example, there's a drug that they make in India, it's a tablet. This is, here they'll charge to $800, and in Brazil they'll sell it for like 7 cents or something like that. Is the price of the drug has nothing to do with how much it costs to make, only how much you're willing to pay. That's about it. That's the only thing constraining the price.
That when you said $100,000 to $200,000, how much does that actually cost them to make the treatment?
Yeah, it's very little. It's all the research that goes into it. But even then, it's not commensurate with the cost of the research, because the marketing costs are higher than research budgets. Like the marketing budgets more than they put into like, why don't you put the money into making good drugs instead of marketing, right? Because somebody's got to pay for all the doctors' free meals, and they've got to pay for those $1,500, and they've got to pay for all the university professors you've bought out, and all this. You've got to pay for those studies that prove that you're good. It's a difficult system.